Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome to this very special episode of GLI Live. I am your host, Donna Cryer, the CEO of the Global Liver Institute. And today we'll be talking about telemedicine, equitable care, and so much more with our guest, Dr. Reed Tucson, who amongst his many, many roles and accolades, which we'll get into a little bit in just a moment, Dr. Tucson is the managing director of Tucson Health Connections. He is a board member of the Black Coalition Against COVID, and he is the author of The Doctor in the Mirror. Welcome, Dr. Tucson.
Thank you so much, Donna. Great to be with you and your audience.
So, Dr. Tucson, may I call you Reed? Because we are friends.
I would hope you would.
Okay, fantastic. So, Reed, you have played so many different roles across the healthcare ecosystem and contributed in so many different ways. Can you tell us a little bit about how you got into medicine and how you got involved in these different roles that have so much value today?
I was very fortunate in my life to grow up around minority health professionals, physicians and dentists that were in my orbit. I was very lucky to be raised by a visiting nurse and by a professor of dentistry at Howard University. I watched every morning as a young child, my mother put on the visiting nurse uniform, the hat, grab that black bag, get into her car and go into the poorest parts of Washington, D.C. and walk down alleyways into all kinds of environments and then minister health-wise to people who were in so desperate need of care. I have never been able to get that out of my head. Even to this day, my father helped build the College of Dentistry at Howard University, and I was privileged to watch a group of dedicated men and women trying to create in the midst of racism, of being deprived of fundamental resources, and yet against all odds come together to create something that would save the dental health of people of color. So the upshot of that, Donna, has been that without even knowing it, my personal mission was formed early on to help as many people as possible to be as healthy as possible. And that's been my job even before I went to medical school. I was involved in community-based health engagements, and I've kept that commitment over these years.
That is fantastic, and I know that to be true. And all of those things that you talked about, visiting nurses, access to dental care, those are so much a part of the current conversation. It's as if we're discovering again the things that we knew back then. And so how are you bringing some of those things that you learned at such an early age into communities today?
I think what's been very interesting and I think your observation is spot on. Now everybody is talking about social determinants of health. Mm-hmm. Everybody's talking about equity in healthcare. Mm-hmm. Well, those of us, and you know this so well from your mm-hmm. own experience, those of us in the Black health community have always been dealing with the social determinants of health. We've always known that the cause of disease or the worsening of disease once mm-hmm. present were so intimately intertwined with what happens in the life of the community itself. Right. And so I think that the ways in which we're trying to focus, for example, now with COVID, I'm very pleased to have co-founded the Black Coalition Against COVID. And that was specifically designed to engage the Black community in DC, where we started, mm-hmm. and being a community grassroots effort to mobilize people of influence, to mobilize the culture, to accept the kinds of guidance and science-based guidance that we were learning at each stage along the COVID journey, to try to get people comfortable with those things, to try to make sure that we were supporting church organizations
Right.
that were starting to plan the use of models like health navigators in the church, where you have the pastor deputizing a member of the congregation and then have them begin to survey their constituents, their friends, their neighbors, other people in the congregation, and see who's suffering from problems with food insecurity, who's suffering from domestic violence, who's whatever the issues are, and then be able to connect them into resources to help ameliorate the problem. These are the kinds of things that we have been doing in the Black community all of our careers, but now they're taking on an ascendancy. They're becoming more formalized and accepted. Now that you put a name to it, oh, social determinants of disease. Oh, okay. Now we know that all the work we've been doing actually had a formal title.
Well, it's gone through so many titles. I'm okay to admit that I'm old enough to have seen it come through multicultural health and health disparities, and now social determinants of health and health equities. By whatever name you call it, getting services to people rather than having people try to come to services and through their jobs and their childcare and every other challenge and priority they have to their life, just makes sense, is the only way we're actually going to have an impact. So I'm so glad that you're getting traction, beyond the converted.
Well, I think that what you've really kind of indicated now is a certain need for more energy, a certain heightened level of, and I use this word carefully, but militancy around how we advocate for patient centricity.
Right.
One of the areas that I'm very focused on these days is the incredible importance of data and analytics. Having data that describes and facilitates our comprehensive patient-centered response to challenges. Of course, your community knows this as well as anyone, given the multiplicity of challenges that are faced by patients who are struggling with liver disease and the therapeutic treatment of those. And so what I'm hoping now is that, for example, I'm still watching an exasperating absence of interconnectivity and integration of data across settings of care, and that is focused on the comprehensive needs of the individual as opposed to the myopic needs of the institution or the provider group or whoever it may be. And so one of the things that I'm really trying to do in every way I can these days is to start to arm patients with advocacy tools and demands that says, if we are to achieve a truly patient-centered environment, particularly, let's say, in data, we then are going to ask every healthcare purchaser of electronic records or public health departments that are involved in buying data aggregation tools, are these tools that you are buying, are they going to lead us towards patient centricity or continuing to have the suboptimal, fragmented, siloed data care that informs care today? And I think if we can give patients a cheat sheet, an advocacy sheet that says, we're going to ask every hospital, every purchaser of data tools, does it do this, this, and this?
Right.
Then we're going to have a problem. So we have to build a heightened demand for the kind of things we want. So I'll be sharing that with you, Donna, and maybe you all would like to be a part of this effort if it makes sense to you.
We absolutely would. I'm really excited that sitting on the board now of a hospital in the DC area. So, when they ask, where does patient engagement start? I'm like, well, on the board in a governance position, that the president of our national capital region is now probably at the same time on a panel with Dr. Lisa, who I know you know well for her work in digital health and community building. And so to put the resources of someone like Sibley and Hopkins Medicine on the right side of history, on the side of the community, and to bring our resources to pair with digital health ambassadors is, that's what's exciting to me about being an advocate in this day and age and on this stage, so that patients are asking the questions, patients are querying the data. We know that the concerns of the community are the things that get asked of all of the data that's collected on us. So I'm absolutely aligned with you 100%. Tell me where to sign and where to go.
Terrific. Well, I'm really glad, by the way, that you've made your point about the importance of advocacy. And I think that there is something that I have learned from you and that has influenced me in very profound ways. In all of the conversations I've had with you, and we've had some very intense conversations around moving the ball forward in a variety of areas, and particularly your leadership around clinical research. And what I'm getting at here, Donna, is we have got to reinvigorate the fight for life. We have got to help our nation come back to a place of love and caring and concern. The pain that we have come through on COVID has not only been the tragedy of 1 million lives or more, probably much more lost, but it was the casualness of so much of the nation's response. It was almost as if these were expendable lives that are getting in the way of the football game, or getting in the way of going to the concert and live, or whatever the political agenda of irrational people has been. My point being this: I don't think that this nation is going to do well for the next few years if we cannot come back to a place that says we care and love each other. And I think that your advocacy as an individual, your personal story and the passion with which you tell it, but also the way you tell the stories of the people who you encounter in GLI, that has to be raised even more higher on the nation's agenda. And all of our policy deliberations need to be no longer assuming that the preservation of life is the #1 priority. We're going to have to reinvent that and put it back on the agenda where it should be. And that's going to take the stories of the people in GLI and you as a leader.
Thank you so much for that. And I've learned as much or more from you. And so I think that demonstrate the principle of interconnectedness, that hopefully we've come out of this time period in COVID. We're still in it, but we've come in the past 2 years with a better sense of how we need to value each other. And we need to value the different types of expertise and perspectives that everyone brings, and that we are all interconnected. And so certainly not only as a liver patient, but so privileged to be able to be still alive today, so blessed by so many nurses and physicians across so many specialties, across so many conditions that I have been living with. And so my hope is that the opportunity for us from healthcare is to recognize that interconnectedness in our service, and better coordinated care, with an opportunity to, when we have someone in front of us in any care setting, to be able to say, well, have you been vaccinated from COVID? Have you been vaccinated for hepatitis B? Have you been screened for hepatitis C, for NASH? What is your cholesterol? What is your diabetes? And really make sure that we're looking at that whole person's health, whenever and in whatever context we have them, whether it's at their church or in a health fair, or whether it's somewhere like Sibley, or whether it's at a CVS or a Walgreens or a Walmart, but be able to use the opportunity to assess that whole person and their healthcare in context. So that's my hope.
If we keep walking down that road you've just started, this road of caring interconnectivity, that also takes us to a very important place of organ donation. Yes. And I start to realize again this sense of what I have, I can also give, even under sad or tragic conditions. Yes. My oldest son taught me this lesson. I lost my oldest son when he was about 30 years old. And it was a very painful experience. It was a difficult death. It wasn't. There wasn't a great deal of nobility to it. It was a difficult, painful death that he suffered, and it hurt us deeply. However, I remember getting a letter from the organ donation people telling us where his organs went, and then when I saw that, I wept. And I wept not out of sadness, but out of a sense of relief, out of a sense of the mystery of the interconnectivity of life. And some of the people that got some of his organs were very different probably than he was. Very different cultures, communities. And you start to really fundamentally realize that there is an interconnection and an engagement between us as human beings. And you are living that. And GLI is living that. And so, again, anything that we can do to enhance the feeling of connected humanity at this moment is the most important thing that we can do. So please keep doing as you're doing, telling the stories, not only telling the stories to get more organ donation, when we have to do that, but it's telling the story of life and respecting everybody's life and our interconnectivity. That story is probably more important even than the specificity of the task at hand.
At 27 years and counting, it is an honor to tell the story, but I recognize that not everyone has the opportunity that you and your family did to turn tragedy into triumph. We've shined a spotlight on the number of organ procurement organizations that don't send staff out to everybody who looks like us, that doesn't send staff out at all hours of the day to have every opportunity possible. And so our advocacy and ensuring that wherever you live in the country, that you have a high performing organ procurement organization that is doing everything possible to get every organ possible, to save every life possible, to give every family, Black, brown, white, to be able to donate if that's what their choice is, to explain the possibility to them. That's something certainly worth fighting for. And we feel an urgency for that we've been trying to communicate to CMS and HRSA that, that this needs to happen now, not 4 years from now, not 8 years from now. It's one of the few things that we have bipartisan support on. We have support across. It's one of the few things we have support across, the Trump and Biden administrations on, that this is an opportunity to save lives now and to ensure that for livers, the waiting list could be eliminated. There are 13,000 people today, but the data shows that we could eliminate everybody, get an organ to everybody who is on the waiting list. And to me, that's worth fighting for, rather than fighting over, is it someone with a rare liver disease, or from NASH, and causing stigma and shame and blame. We really can be ensuring that we can do what we already know how to do to save everybody who needs a liver transplant. And I'm really excited that we're moving forward to be able to do so. And then we can start working on how can we make sure everybody survives as long and as well as I have, that they're more worried about their Peloton streak than their, than their creatinine levels or their liver enzymes and things like that, because that's when it starts to all become joy, but not enough people get to that.
Well, from my perspective, and again, stepping back from the specificity of your task, what excites me from the larger perspective is that's contained in your last comment is you're having conversations with people about science, about what works. you're trying to debunk a series of very difficult myths
Right.
about needing to go to heaven with all your parts intact, and somehow or another you just go from death to bouncing around on a trampoline in heaven somewhere, with the same configuration. My point being this is the difficult moment now coming out of COVID, where we have learned that there really isn't trust.
Right.
We don't trust the information. We don't trust the science. We don't understand science. Myths are abounding like crazy.
Right.
And so every sector of health today has got to be shouldering its part of the responsibility for learning how to talk to people in terms that they can understand, talking to them from a trust-based point of view, and making sure that we are, all of us, adding fuel to the movement of evidence, science, trustworthy messengers, overcoming misinformation and rumors and so forth. And that's, I would just say, outside of the specificity, Donna, of your work, you're going to be adding and have to add a lot more value in the larger picture that I've just described. Otherwise, we are in very serious difficulty. And as you know better than I, that will especially manifest itself potentially in not having people sign up for clinical trials for research.
Absolutely. Some of our very good friends, Garth Graham and Rob Califf, are on record saying that misinformation has perhaps killed more people than COVID and all these other diseases combined. And so we all have a responsibility to combat that with correct information and patience and time with people, meeting them in the languages and the experiences. I've had conversations around vaccination and masks with that are some of my proudest moments in advocacy. They've been with my, my African-American, makeup artist who was like, I think this is conspiracy. I'm like, well, there may be, but this isn't it. And so get vaccinated. I've been vaccinated. This is, I feel fine. This is why I feel it's important for you. She also has a chronic disease. And so we had that conversation for a while. I just keep answering questions, meeting her where she was. And then I've also had a same conversation with a gift shop owner in Austin, Texas, who finally at the end, after we were able to sort of talk and connect, he went in the back and he was like, was this the type of mask you were talking about? Yes. And so, he walked when I walked out, he was wearing his mask, and he felt that he had had a respectful conversation with somebody who didn't treat him like he was stupid, didn't treat him like he was other, that was answering his questions, and that we found common ground. And then he was wearing a mask. So those are some of the moments of advocacy that I'm proudest about, because they've, to your point about connectedness, because it connected with someone, and they'll connect with other people in their community and say, I met this person, and she gave me information that I hadn't really heard before, or in a way I hadn't really been able to take in. She took her time, and I think differently about this now, and maybe you should too. And I think that's how we share information with our families and our communities, and change minds and hearts, and overcome skepticism, and so much fear. I think that's how we do it.
I'm going to do the same thing I've done. I just realized for almost every question that you've asked me, and go from the particulars of what you said to the larger, more macro perspective. One of the things I'm realizing as we are having this conversation is that I have not done well enough in my leadership role fighting COVID in the Black community, is to use your examples as part of a more emotional campaign around why do we wear our masks. I wear my mask not just to protect myself, but I wear it to protect others. And we talk about protecting those who are immunocompromised. And that is a lovely phrase. It's a word. As I think about it more and more, you can say the word immunocompromised people who may be at risk. But that is very different than saying there's this wonderful woman named Donna Cryer who has this journey and da 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 da. And when you don't wear your mask, you jeopardize Donna Cryer's life. Are you so self-absorbed as an individual that you couldn't care about Donna Cryer? I mean, there's 1,000 stories like that out there. And what we have not done well enough, and I will commit that as we go forward, we need to bring up and elevate up the narratives from the global liver community that explains to people and helps them understand the human face, not just the technical word, but the human face of people who are struggling for life, who have been through surgery, now on drugs that make them vulnerable. Through all that process, they want to go to the store too, and they don't want to go to the store and get killed because of some self-absorbed idiot. And I think we've got to start bringing these kinds of things forward. So we need to do more on that.
Thank you so much. It means so much to patients in our community to hear that, because one of the biggest things about liver disease is there's so much stigma. We don't feel valued. And during COVID, when we were not prioritized for vaccination, even those of us who've been through liver transplant or liver cancer, and we were way down the list, and it really felt like nobody cared if we lived or died. And now, as the world is opening up, I have patients come to me every day and it's like, well, but I want to leave my house too. It's been years, and I want it to be safe to leave my house to go to a restaurant or go to a family wedding. And if people will, wear a mask or, use one of the free antigen tests on the day before we go out, then we can safely come back into the family and community fold. But unless that happens, we literally stay isolated, and the depression and just the feeling that we don't matter is just such a huge weight on so many people. And so something as simple as a mask, something as simple as the free antigen tests, so that we can be embraced again, is so important.
I'm going to memorize. I memorize what you just said, and I will commit as a tangible outcome of our conversation that I will add that to my presentations. When I talk about these issues, I will guarantee you that that will be a deliverable that's touchable and tangible that will come out of this conversation, which I always have to assign myself that once we talk about things, then what you're going to do, what you're going to do. And I'm going to do something based on what you just said.
Thank you. I appreciate that. One other thing before our time is up that I know you are very involved in, and that's very important to me and so many patients, not only with liver disease, but other chronic illnesses and seniors and others, is telemedicine, is being connected digitally to our doctors, not having to necessarily leave the house, travel miles. If so many of our patients are in rural areas and have to travel hundreds of miles to their transplant center or their cancer center, but we now have access to telehealth, and we don't want to lose it. And so what can be done to ensure that the access that we now have to an expanded set of people at expanded times of day, to an expanded set of physicians through telehealth will not be taken away?
Well, of course, it always does come down, of course, to advocacy and telling the stories and making sense. So we have to be very attentive to the reimbursement for telehealth and make sure that there is a financial reason for the providers to stay engaged. That is important. And so pay attention to reimbursement. But what I think is particularly important, and again, it comes back to your specific capabilities, Donna, as a leader and what you're good at, is that I think we have to always make sure that also that we have the cost benefit of the use of telehealth. We've got to explain not only the convenience, which you're very good at, and others, it's intuitive, but what we also have to augment that with is, from a cost perspective, why is this cost effective? As you well know, the delivery system is increasingly unaffordable for the average American. The numbers of Americans, and your community is right in the middle of this, who cannot afford their co-pays, who cannot inform their deductibles or an emergent event. The numbers are staggering. And so anything that we do in healthcare, if we think it is valuable and good, it has to be sustainable. And it has to be sustainable means it has to be economically rational. So we have to look at how these services are organized, and you need to be a part of the effort of making sure that they are practical. The other thing I would say very quickly before we run out of time is I think that there are so many related devices and capabilities associated with telehealth, not just the interaction with the health professional, but the monitoring tools, all of the digital tools and the apps that are now available as a part of healthcare. We need to be very, very good now at teaching people how to be competent in using those tools. Those tools require a skill set and an understanding. And so we're going to have to teach consumers and patients how to best make use of these. And then we have to come back to where I started earlier in making sure that the data that flows from these devices and tools are incorporated into a patient-centric health data system. And that ties together the point I was making earlier in our conversation.
I look forward to working with you on all of these issues, on making sure there is community engagement from governance to education on creating digital health and equitable health as just health. So thank you today, Reed, for joining me. And thank you to everybody for listening and watching.
Thank you.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.